The title speaks for itself. My name is Lew Lim from Vielight, and I have to disclose any conflict of interest. So we are manufacturers of photobiomodulation devices. Now we will cover. This session is really about photobiomodulation and not specifically to the devices that we do, Vielight. But, we're pushing the boundaries of research into various outcomes, including traumatic brain injury. So it's inevitable that you have to forgive me that I will need to go to some of the development that we are doing. But just stating here that our devices mainly are not approved as medical devices. They're general wellness, low-risk devices. And we are seeking FDA approval for a number of conditions. Traumatic brain injury is one of them. And that takes a bit of time. We probably get faster approval out of Health Canada. We have one already approved for COVID-19 treatment. That's the preamble that we need to go through. Now, brain injury is a pretty big thing. We do a lot of clinical trials within ourselves and our network, like, dementia, long COVID. We're covering like places like autism, and, it's quite a number of areas. I don't even have them all on my fingertip right now, but I'll say traumatic brain injury, although it's not as big as what we did for COVID-19 in a big trial that got approval from Health Canada. I say the deepest evidence that we've got, and we feel really, really confident, is actually the effect on traumatic brain injury. Now, big numbers, 1.7 million people are victims of traumatic brain injury every year in the US. Astoundingly, 52,000 people died. I think these numbers were, they came out around 2019. Imagine if you attend baseball stadium, the average attendance is about 26,000. So just imagine, double the number of people die every year from traumatic brain injury. And it's a big deal in sports. I don't have to mention it, as you probably know, football is a big factor in the amount of injuries present. I'm surprised that basketball also featured quite prominently. But here we are. I'll talk a little bit more about the effect on football players. So how important is this? Especially among the veterans. In the Speech of the Union address, State of the Union speech by President Biden earlier this year, actually, suicide risk among the vets was quite a big deal. And the numbers come to, I did the numbers myself before his speech, actually. The White House came out to 17 people die every year on average among the vets. So the risk is very high. And I understand the US government is really trying to do something about this. Now, if you go back about who are the people at risk among the vets for suicide ideation, I say traumatic brain injury actually feature pretty prominently. This was a study that was published actually very recently, looking at the data and looking at the connection between traumatic brain injury and suicide risk among the military people. The time to suicide was 16.7 times faster than soldiers without a history of TBI. So that's one thing. But among those with a history of TBI, indirect causes, they found that substance abuse contributes to 63.8 times faster. So that's quite a lot. And, traumatic brain injury leads to all kinds of problems. It leads to substance abuse and a higher risk of TBI. So the numbers are pretty big, and I think it's a good thing to try and address it. Now, in traumatic brain injury, a number of things happen to your brain. Right, it goes from cerebral edema, cerebral hypoxia, metabolic impairments. We go down, the list is here on the slide. Cell death, I will be covering that. Increased glutamate, which is creating toxicity in the brain. Mitochondrial dysfunction. This is one of the areas we try to attack with photobiomodulation. And then you have inflammation, reactive oxygen species, which is free radical development, blood-brain barrier damage, which causes a number of problems too. Now, this is another way to present it. On the figure on the right, all this stuff is going on in the physiology of the brain and mechanism leads actually to the degeneration of your neurons, and particularly, the degeneration of the myelin sheath. When the myelin sheath is damaged, it leads to eventually the death of the neurons itself. And then it leads to the risk of something called CTE. Some of you are probably familiar with that. Chronic traumatic encephalopathy is a name for encephalopathy. It's a disease of the brain. And that's where it starts looking like, a degenerative disease like Alzheimer's disease. And all these things, the flood of calcium ion and so on, does lead to eventual this and neuronal death. Now, how does photobiomodulation come to play? Now, the good thing about all these years of research in the photobiomodulation field, covering various elements of such a physiology mechanism in the brain, is in every major factor, there seems to be a study that actually looked into it with photobiomodulation. I've listed here the various studies that are related, for example, to intracranial pressure, ruptured blood vessels. There's one study there, at least one. The cerebral hypoxia, excitotoxicity, apoptotic cell death, inhibition of axonal regeneration, neuroinflammation, and oxidative stress, and mitochondrial dysfunction. I'll say the last one actually probably have the big mass of research done. So we have that. If I have the luxury of time, I'll link to all these various studies. Very, very interesting, but we shall just take that and move on. All those who deal with traumatic brain injury know that there is no medication specific to treat something called TBI. It's such a heterogenic kind of a disease to try to address, and it's multifaceted. So the question is, can we have something that is convenient, possibly, that have these multiple pathways to try and treat this complicated disease? And photobiomodulation may hold promise. I mean, ultimately, is going to be, the evidence that we can produce in controlled studies, right? And so, what do we have? Now, here is again a representation of in the various studies done with photobiomodulation. And the point is, if you have a complicated brain disease or condition that has to address multiple factors, well, maybe this is a good one because it addresses cell death, repair, production of brain-derived neurotrophic factors, growth factors to try and repair. And I'll show you there's seemingly crazy evidence that something like this can actually help your brain to regrow brain tissues and brain cells. which was something about 30 years ago. Nobody think, your brain can regenerate brain cells again. So there is a excitotoxicity. It helps to produce neutralizing of proteins like superoxide dismutase, SOD, and so on. So the key words here is, without going to the complications, it's just simply remember growth factors, helps with blood circulation because it relaxes the blood vessels. It's anti-inflammation. This is becoming a stronger and stronger feature of photobiomodulation because we use this particular property to try and treat COVID-19, and we actually showed significant effect. And part of the reason, I believe, is the ability to control inflammation and reducing excitotoxicity, as I've mentioned. And it is the work on the mitochondria is interesting because it is acting on the electron transport chain in the mitochondria, which has the last terminal has this receptors for lights called the cytochrome C oxidase. You know what? From the evidence that's shown, it seems to respond when your cells are away from homeostasis. So it responds better. It's away from the balance it's supposed to achieve. Then when you are in homeostasis, it doesn't actually respond as much. So it's quite in that sense, it tells us why photobiomodulation within certain control parameters is safe, because it just doesn't really go beyond unless you push it. That's another discussion. So what are the research done with photobiomodulation on traumatic brain injury? There's quite a lot done, but throughout the years, and it is a difficulty in conducting human studies, that decades of research have been focused on what's happening to the cells and see what's happening to the animals. So I actually reviewed this paper, and I said, up to that point, when they look at the meta-analysis of the evidence, you got to say that really what we've done so far with what you've done with your review is on animals, not on human. Human studies are actually very small, and I'll come to that next. So these were some of the earlier studies. So they don't qualify for a meta-analysis like that because it's just one couple of cases, exploratory studies, But I think they're important because they lead us to what we have to do to get bigger evidence of what photobiomodulation can do for traumatic brain injury. And earlier study was 2011, a couple of cases. There was some discussion papers review. But it's just crying for let's try and do bigger human studies. Then we did one with the University of California, San Francisco. Linda Chow was a professor of radiology and psychiatry over there. She took this on and she came to me and said, "So we got a professional hockey player, who is in the San Jose Shark team, suffering this impairment and so on, and let's see what we can do about it." So I said, she said, "I want to try to deliver 40 hertz to the brain, the gamma, because I've seen this evidence and that evidence, what's happening." But he actually did not like 40 hertz to the brain. It gives him some headache. So I said, I really, based on animal studies done at Harvard, they actually use 10 hertz, seems to produce results on mice, and no side effect. And so she used the 10 hertz, the alpha, and he actually recovered. He had pretty good measures, clinical measures. But what I like about this was because Linda is a professor of radiology. She has access to obviously MRI scanners and so on. And she did an MRI scan on the brain. Now, what she found in summary was there's a recovery of gray matter volume in the thalamus. As you know, thalamus is really key to the functioning of our brain, and the other areas of the hippocampus. So this is almost as good as a control study because imaging, I think, is quite objective. That is one of the probably the earliest indication of photobiomodulation ability to regenerate brain tissues through imaging like this. So it was a bit of a breakthrough. We had a webinar like couple of weeks ago, actually based on studies done at the University of Utah, led originally by David Tate, then Elizabeth Wild here, along with Kerry Usopenko from Mount Sinai in New York. Now, they have submitted a number of papers for publication. It's pending its review. So I can't, unfortunately, show you the data in detail, but I'm able to show you this poster presentation that they did since it's public. Now, this is a study on former athletes with repetitive head hits. It's not in a peer-reviewed journal. It's already submitted, but this is made public, 49 of them. And look at the symptoms that were addressed here. These all, there were various titles for the scores, but basically I've put in red on depression. The outcomes are significant. Looking at the p-value, they're very, very significant. PTSD is often a symptom of chronic post-concussion symptoms. The rehabilitation, sleep, the reaction time, and the other benefits that come out of it is the testing on the grip strength. So it's really promising. It's 49. What I hope to do and our network hope to do is actually translate something like this and the other things that they've done at Utah into a bigger study in time. I'll touch that a little bit later. But we have an ongoing study now at Boston University too. This has been going on for like several years. It is sometimes very difficult to recruit people to come into a randomized controlled study, So it took quite a while to do that. And this is, I think it's going to be wrapped up pretty soon, so we'll see what the results are. But I want to talk about leading from mild traumatic brain injury to CTE. I mentioned that very briefly. Here, you're progressing into a degenerative condition. Now, the paths go from primary, secondary, neurological deficits is what the focus is about here in CTE. The loss of neurological function, cognitive decline, psychological alterations, and chronic disability. And typically, you don't know whether that athlete or whoever it is had CTE until the person dies. Especially among retired football players, there's a movement going on. They donate the brain, and there's a big archive in Boston University run by Anne McKee, and they slice up the brain and say, "Oh, look at it! The brain looks like the bottom picture on the right side. You still suffer atrophy and marks of tau all over the brain slice." Now, to say somebody has got CTE is only suspected, but I believe there is a way to do it nowadays. You can actually do MRI scan to actually see that and give support to your suspicion. I would talk a little bit about a person who has been doing that. This is an example. He's like the epitome of what's happened with CTE. Aaron Hernandez, you football fan, you remember, he was recruited by the Patriots along the same time as Rob Gronkowski. I have a hard time mentioning his name, but he's a star now, but he went the wrong path. So he actually developed CTE, and he was arrested for murder, for homicide. And while he's in jail, he was then also charged with another homicide, and he committed suicide. This is the section of his brain. So I talk about atrophy. Look at the ventricle. It's enlarged. The volume of the white and gray matter has shrunken. Now, CTE among football players is a pretty big thing. And there were numbers coming out like, I don't have it here, but 90% of the brains that were contributed to Boston University actually had symptoms of CTE. So it's something that we really want to look at. You can study this in detail if you want to look at the pathology of CTE and what are the markers. This was published recently. I worked quite closely with Margaret Naser, who is a research professor of neurology at Boston University and the Boston VA. It took her quite a while. She was sitting on this data for quite a while on full retired football players. Part of the thing is for some people it's not a lot, but she and her team studied in depth, although there are few numbers, but she looked really deeply into the various symptoms and what's possible. And I personally thought it was a good paper. Look at the trend. What is this saying? There were 4 retired football players who had quite severe symptoms. They went to her lab for treatment for 1 week using photobiomodulation. It was a big helmet with a number of LEDs in it, and they improved. You can see for inhibition, handling false alarm, immediate recall, total recall, and so on. See if I have a next slide. Okay, there are a number of symptoms being tested. Here is PTSD, depression, short form recall, and a number of other things. And then I think this is another subject. That was P1 and this subject P2. So there are quite a number of this, but I'm just picking up a few. But what is interesting here is, let's take PTSD, the top left, as an example. They improve on the first week, then they say, okay, study over after 1 week, go home. They go home, and you can see the decline over 2 months actually, and then say, okay, everybody is distressed. They're getting bad. I want to go back to the lab to treat, but IRB says, okay, 1 week of treatment, you can't go back. So they were given a device for home treatment, and they improved. Look at this other thing. The trend is pretty consistent. Now, what is this telling us? It's telling us that they are having some kind of degenerative disorder in the brain, so they go down. Something like Alzheimer's disease. And if you don't do anything, if that methodology works, that intervention works in the beginning, hopefully it works again when they get back on, and it does. The lesson here is, if you have a degenerative disease like we understand with Alzheimer's disease and dementia, you have to do it regularly because I think now your genome is being altered. Alzheimer's disease is also a factor of the genome. And it is no harm in doing every day if the method you're using is convenient. That's why I'm a believer in doing home use device, convenient, and affordable for people to just keep doing every day. And the side effects, the benefits are good because they improve in their daily life living and the cognition and handling of daily lives. So there are a few lessons to be taught here. And here's a discussion of various network involved. And, you're talking about these main networks like salient, central executive, default mode network, they're all affected. So it's not, in a way, it's multifaceted. What they did also was to look at markers, metabolites, and NAA is one of them. NAA is an indication of how well your cells are consuming oxygen. And the lack of NAA leads to a number of problems like, the loss of neurons and so on. So what they did was to use MR spectroscopy to see the measure of NAA and found that if you looked at pre-LED treatment, 1 week post is gone up, 6 week post is up there, and 12 weeks, it's come down a bit, but it shows that when, during the process of photobiomodulation treatment, it does help with this. We are also doing, not me, but our collaborators are doing a study on the, biomarkers like this at the University of Toronto and St. Michael's Hospital on dementia patient. And they looked at pyruvate, and they looked at lactate. These are also indications of metabolism. And they are saying that they haven't published yet, but they seem to be responding to photobiomodulation on the brain. This is Larry Carr, who is subject number 1 that I showed you in that study at Boston University. So what happened to him since? That study was done quite a number of years back, and he wanted to do a video to share his story. So let's play that.
I love football. I always have loved football. I loved everything about it, but I paid a heavy price. About 20 years ago, I started feeling symptoms related to what I later found out to be a brain injury as a result of football. It started to build to the point where it became almost debilitating at times. It was suggested that we go visit Dr. Nazer at the Boston VA because she was having success treating vets, Gulf War vets with near-infrared light. And we started a 6-week protocol where they would shine near-infrared light on my head for 20 minutes, 3 days a week. I'm using the device for 3 years, over 3 years now, and I'm still finding changes going on, positive changes that affects my relationship with my wife, with my children, my adult children, and with my coworkers, and especially with my grandchildren.
So Larry is now an adjunct professor at the University of Utah. And he's the guy that said, okay, get his other members of the university to do investigation on this. So he's part of the reason why University of Utah is now putting quite a lot of effort into the research of photobiomodulation on brain injury. But he said, this is changing my life. He was, I don't want to go into a lot of details, but, he did mention it. And so he was really in a bad place. And he's now very normal. You talk to Larry, he's pretty sharp, he's pretty normal. I see nothing wrong with Larry other than a pretty smart guy. And he's almost like a personal crusade. Let's do something about the problems you see in football. I don't want to go into the politics that Larry told me about in the in the field. But we have a strong advocate and leads to quite a number of things that we want to do with that university. So we have a number of ongoing studies going on. Okay, we saw clinical outcomes, a little bit of biomarkers, but what is happening right to the brain when you do photobiomodulation? We have an ongoing, it's still going on at Baycrest Hospital in Toronto, which is also affiliated to the University of Toronto. And look, the brain actually lights up. You put the right, in this case, 808 nanometer near infrared light to the right temple, one of the nostril. When we started the study, we said, I think nothing's happening until they experimented with different power densities. And it hit some right power densities, and suddenly, whoa, the whole brain just lights up like that. So this was on the right prefrontal, and you see there's more activation in this, the cerebral blood flow and bold on the right hemisphere. You see the right column, and not so much on the left. Then we looked at, it is pretty power density specific. In this particular subject, we've gone to subject 2 and 3 and so on now, that there's a certain peak, like 150 milliwatts per square centimeter. When we pulse it at 40 hertz gamma, it just is up there. But if you increase the power beyond that at 250 milliwatts, it actually goes down, this inhibition. So it matters how you design the parameters for brain stimulation. Then, here it shows that it peaks 150, then they tried 175, it's not as much. So it's quite power density specific. We looked at the intranasal. Intranasal demands a lot less power. Pulse at 10 hertz, we saw it really picking up only 9 milliwatts. So again, the lesson here is you have to try to personalize if possible. Then what if we combine, the right and the left intranasal? Now you don't see the right being more activated than the left. Actually, the left and right light up totally. Now, in that analysis, they actually left out the cerebellum at the moment. Okay, let's go back and put back the cerebellum and see what's happening, because I think the cerebellum is very important. We just had a meeting a day before I came to this conference. So we have subject 2. It looks a bit different, but generally there's no dispute that the whole brain respond really strongly. I've not seen anything similar in the literature for for TMS, which is transcranial magnetic stimulation, or TDCS, transcranial direct current stimulation. Now, I think this is going to launch us to a lot of interesting things. So what is the effect on traumatic brain injury on the various waveforms? This study points to saying that there is an increase in theta and delta and a reduction in alpha. So alpha seems to be a good presentation to aim for, to try to address traumatic brain injury. Then we looked at what's happening to gamma. And gamma is also dysfunctioned in traumatic brain injury. So there is it's not very visible, but the gray is patients with TBI, and the black line actually are patients without TBI in control. So you can see the power of the alpha in various regions of the brain actually are compromised. The top one is all sides, the anterior, the left hemisphere, right hemisphere, posterior region, they're all compromised. So gamma is also a good waveform to look at, see if you are succeeding in treating traumatic brain injury. we actually did. We delivered gamma to the brain. Quite a number of you are quite familiar with this particular publication, published in 2019. Healthy brains, and what's happened. This was novel. We didn't know what to expect, but delivering gamma to healthy brains actually elevate the power of alpha, beta, gamma and reduce delta, theta. So if there's a complaint that delta theta is too high, like in the case of TBI and maybe ADHD and a number of conditions, maybe you try to deliver gamma to the brain, you can get this effect. And this is another way of showing it. The top line is you're familiar with in this brain maps. The bottom line shows the increase in alpha, beta, gamma, and the reduction of delta, theta. The cerebellum I mentioned is quite important. We see in the literature cerebellar damages in blast TBI. Now, what's happening is you can see the sham on the left column of pictures, and the right, the blast very clearly damaged, very costly. You get swelling and death of brain cells. So we need to also try to address, the cerebellum. Now, this is a measure of a marker, amyloid precursor protein, the density of this marker, often associated with degeneration of the brain. After various, blast condition, you can see the picture there. One day after the blast, you see this huge presentation of the density of the amyloid precursor. 1 week later, it's still there. 1 month is still there. If there is 3 blast events, 1 month later, the symptoms are there, very, very high. So, cerebellum is an important part of the brain tissue to address in traumatic brain injury. The 40 Hz is important. There's quite a lot of work done in MIT particularly, and people forget that UCSF have done quite a lot of work on the presence of gamma in the brain when your brain is encoding memory. But the point is, at 40 Hz, it seems to activate the non-inflammatory microglia to reduce the beta amyloid load in the brain. So try to get 40 Hz into your brain if you have TBI too. So we try to do it. This is a form that we do it with this device, and those were the effects that we're getting. Now we are coming up to a big clinical study. Hopefully, we're going to see FDA for pre-submission and say, okay, this is going to be a protocol. Try to keep it as simple as possible. We have devices, and we want to switch between. I've talked about, try to get strong presentations of alpha, 10 Hz and 40 Hz. So we try to do this, use this protocol in the clinical trial. And if you're addressing TBI yourself, maybe there is something you want to look at, because after all this thinking and so on, we think this is a very simple protocol to try to address TBI. So in summary, I'll say there is a strong support for photobiomodulation to treat TBI. Appeals to occupations and careers that involves impact on the brain. It's simple to use actually. To date, the evidence is strong, and I think photobiomodulation holds a promise. So we are creating, based on the work we're getting, I mentioned that we're getting really deep, good evidence on photobiomodulation with traumatic brain injury. And we are creating, together with the University of Utah, like a center of excellence at the Salt Lake City campus of University of Utah. Now they want to do more investigation. There are a number of studies lined up. They have quite a lot of enthusiasm going on. And they will also probably going to be the primary site when we do this big clinical trial with Elizabeth Weil, the professor there, as the primary investigator. So if you're at other universities, you want to be part of this clinical trial, write to us. I think you will write to them at the University of Utah. They will, keep you in mind when the trial starts. We are also doing a lot of work in Toronto, where we're based. We have a lab that do quite a lot of work with EEG, meditation. We're looking at TBI is another one. We coordinate with other collaborators around the world. And we're getting more equipment in to learn more, because the more we know, the more we can propose, in some kind of application methodology for everybody. A bunch of people we thank who have been involved in our various studies, the various universities around the world. So, thank you. I want to leave a bit.